those that don't know, Representative Robin Kelly from Illinois in the House was one of the sponsors of the Cybersecurity Improvement Act for IT Cybersecurity Improvement Act, the original bill. That's a companion, ironically, to Mark Warner's Senate bill. So you and Will Hurd introduced that. We were very pleased tonight in the gallery to see political will to push that, and it took 2 congressional sessions, but you passed it into law in December 2020, so thank you for that, and you won our admiration even there. So some people are familiar with you, and we're really excited to see you have interest in healthcare as well. But before we do that, and we should not assume everyone in the room knows you, would you like a few minutes to introduce yourself? And since we're all about passion, what made you even want to be a congresswoman in the first place? What gets you out of bed in the morning?
Honestly, I never, ever in my wildest dreams thought that I would even run for office. My first office, I was a state representative in Illinois, and people begged me to do it, and I said, no, I can't. They'll talk about me in the paper, I'll cry, I'm sensitive. But I had so many people pushing me to do it, so I actually ran against a 10-year incumbent, and really the rest is history. I served for 4 years, and I actually gave up my seat. I was the chief of staff to the Illinois treasurer, and I was the chief administrative officer for Cook County. And then when my congressman decided he didn't want to keep a seat, then me and 17 Democrats, 5 Republicans, and 3 independents ran for the seat that I won. So really, I just want to make a difference. Sounds corny and all of that, but I was a psych major undergrad. I have a master's in counseling and a PhD in political science, but I often say the psych and counseling helped me more in this job than any political science degree, because of just all the different issues and people that you deal with, my colleagues and constituents, lobbyists, on and on and on.
It's funny you say that. Bo has a psychology degree. I have a philosophy degree, and we always we were trained to think soft sciences or soft skills were just lesser. But it seems like the soft skills are pretty hard, and those who master them do a pretty good job. So we're going to sequence and stage this a little bit. Thank you for that background. How did you get interested in healthcare? Because we already respected you. Your staff was one of the first to welcome our cavalry hackers on the Hill. In the spring every year, we bring hackers to Washington to have their first congressional briefings, and you've been a big supporter. Thank you much for sharing Matt McMurray and everyone. But what specifically caught your attention on healthcare?
To be honest with you, even though I ran on gun violence prevention, and that is a public health crisis, but I didn't really want to get into healthcare. I'm married to a doctor, and I don't want to hear his mouth every day or when I got home. So I was trying to steer clear, frankly. But Marsha Fudge, who's the Secretary of HUD now, she was the chair of the Congressional Black Caucus, and she asked me to be the chair of the Congressional Black Caucus Health Brain Trust. So I got deeper into it. I do a lot of work around health disparities and inequities. My district is urban, suburban, and rural, so I hear what you're saying, and a lot of work for the last 7 years on maternal mortality. So that meant a lot to me, what you just said.
And we're going to get to the pandemic in a moment, but I think it's worth noting that this interest predates the additional constraints and additional stressors of the pandemic.
Oh, definitely.
So this is when we talk about leadership, it's about being out front, taking a risk before it's popular. So thank you for that. And which, since not everyone here is familiar with Congress without doing an entire Schoolhouse Rocks, where do you sit in committees and what are your spheres of influence?
I am on Energy and Commerce, which is one of the A committees, and historically it's been around a long time. And I'm on health as my heaviest portfolio, and then they changed the name as we went into the minority, but consumer protection, and that's a passion in my heart. And then I'm on commerce and technology. Last Congress, I was the vice chair of the committee, but you only could do that for one Congress. And I celebrated my 10th anniversary, April 11th, and until this Congress, I was also on oversight and reform. So, that does everything. But when we went into the minority, I got kicked off.
Well, thank you for that context. Now, this group is quite familiar with the additional strains of the pandemic. I just hinted at a few. But how does Congress see, I did testify at Senate Health, but, and your staff was one of the best at asking questions during and after the peak of my Cystic Fibrosis Task Force, even without, being prompted. How would you characterize how Congress viewed these additional strains, these additional ransoms, these additional human life things? We don't want to assume we understand how Congress is thinking.
Sure, there's 435 of us in the House, so it just depends who you speak with. I think some people try to downplay things, but as you mentioned, I was on the IT subcommittee. I was a ranking member. Will Hurd was the chair, and he, along with my young staff, got me into this. I'm not technical. I'm not any of this, but I took a leap of faith in all of them. And so some people very passionate about. We worked with Senator Warner, in the Senate, and Democrats and Republicans. Actually, one of my great partners was Mark Meadows, who went on to work, with Donald Trump, because we just saw how important modernization was, the Internet of Things or cybersecurity and what was happening. So I think it depends. There are some Congress that are very aware and think it's very important, and I think some people don't think about it as much, quite frankly.
Yeah, and to that point, knock on wood, cybersecurity and specifically cyber safety continue to be seen as a bipartisan and bicameral issue across House and Senate. So all these bills have had bipartisan co-sponsorship and collaboration, and I hope that continues, especially during this year of what I expect to be significant changes. So yeah, the Patch Act passed into law last year. I know the House had to pass that first. I'm losing my battery or range. And we know that Senator Warner's got his discussion draft, and his team is looking at patient safety. You gave an introduction to our main event in San Diego last year, telegraphing that you have intends to introduce legislation in the House. And what I love about your approach, and I'd love for you to describe it, is you recognize the haves and the have-nots. You understand that they're the target-rich cyber poor, which is the overwhelming majority of where people get care proximate to where they live. And we really just have two markets. So I think the empathy with which you're saying we both need a higher standard of minimum cyber hygiene, and we need to help you get there. So can you spend a few minutes outlining your legislative framework?
Sure, just to let people, I know everyone doesn't know Chicago, but my district is truly urban, suburban, and rural. I start on 43rd Street, the Obama Library is in my district, but in my new area, I have 2,000 farms in my district too, so I have very rural parts that I'm just, learning about now. And urban, suburban, and rural, I've had hospitals that have had to shut their doors or shut certain aspects of what the hospital offers. I'm like 3 blocks from UFC, so I'm not talking about them. But I have, our hospitals, they're trying just to stay afloat. And we're putting a bill together that establishes a center through HHS. So there's one place that people can go for resources, data is collected, and those kind of things. We're putting together grants because we know that everybody can't afford to do this. We know that it's expensive, but it's expensive not to do it. If you are attacked and your patients are dying, it becomes expensive there. So it's an investment. That's what we're trying to put forward. We're looking at the government putting together standards and for everyone to follow, so that there is definitely minimum standards that every hospital has to have. And then we are looking at liability, and maybe the big guys can help the smaller guys, but if something goes wrong in the small hospitals, it's not that the big guys will have to pay for it. I mean, there's UFC, there's Northwestern, there's Loyola, a lot of great big hospitals that have a lot of resources in Chicago, but there's so many that do not and are struggling every day just to keep the doors open.
And many of us have been helping Warner in your offices cavalry hat and the CyberMed security hat and the Cisco task force hats. So we know you're taking very different, very complementary approaches. And I'd love to see the contrast. We had a spirited discussion at dinner last night that we really do need a lot better data as well. Not so much like specifically which vulnerability and which device got the hospital hit, but simply how many times do we have a degradation to the ability to provide medical care, to which extent, for which duration, so we can actually have an empirical basis to study. Because right now, a lot of the debates we have is, well, we just don't have data. We don't have enough information. I think CERCI will help know how many attacks we've had, but the degree to which either the House or the Senate can try to get granular, actionable information.
And that's why it would be great, like when I talk about a center, it's under one place, you can go and there's the data, and frankly, data informs policy, it informs bills that get passed, and it informs money and where the money goes.
All right, so as we turn the corner, we had a few minutes late start, but I want to make sure we had enough time with you. You heard my remarks this morning. I consider you one of the leaders in Congress. There's leadership in the White House. There's leadership from the executive branch, like Dr. Suzanne Schwartz and her amazing team. They're in the camp of best practices aren't good enough anymore. We're past the point of voluntary only, and we need some fresh and bold thinking. Do you have a charge you'd like to give this group for the rest of the day as we listen? As any advice? Because the people we're working with, I think empathy, you saw it come through with me. We have conflicting truths right now. They're at record high stress and strain and burnout levels. And then here we are about to ask them to do more. They're at record low financial resilience because of the strains of the pandemic, and yet we might be asking them to spend more. We're very comfortable with our best practices, and yet we know they're not working. The political will is here now. So these are hard things, and we need to meet people where they are, but do you have advice for this group on both how to push and how to do so in a sensitive way so that we are helping people to critically think and wake up from their comfort zone?
The only way to make changes is if people advocate for those changes, and I used to do a lot of diversity work, and you can give people a lot of statistics, but you need to tell, I believe, stories change hearts and change minds, and you need to advocate and come and talk to us. I learned because, my staff pushed me into it and will, but speaking to people and learning what the realities of the situation are, and that's what we need to do with members of Congress. That's what we need to do with people in the healthcare profession. As I said, my husband's a doctor, and I wonder if he even thinks about, this kind of stuff, or just focusing on his everyday. And we need to be, compassionate about it, gentle, as you say, because you can't force things down people's throat. But if they see the consequence, the not good consequence, and how it's going to cause more heartbreak, death, and all of that on the other side, then I think people will listen. But we need you too, because we need allies. Yeah, we can be, the person that puts the bill in, but we need allies and people focused on it, the experts, to help us push things through.
Well, I think I speak for everyone here that we're willing to engage and help your team in any way, at any time that you'd like.
Thank you. You guys have been fantastic.
Thank you. And I didn't want to be personally prying to, obviously you've needed medical care recently, so I won't ask, but I assume it's a stress fracture from kicking so much butt.
I'll let you tell that story.
All right. Can we all thank Representative Kelly?
Thank you guys so much.